So, according to studies, an estimated 17.9 millions of people are died from cardiovascular disease, accounting for 32% of global deaths. Alarming, 85% of these are due to heart attacks. So, this staggering number paints a grim picture, highlighting how the heart attacks can strike silently and unexpectedly. With rising cases linked to hectic work pressure, tight deadlines, and personal stress, discussing this issue is more important than ever. Today, we are truly honored to welcome Dr. K. Sarat Chandra, an esteemed senior consultant interventional cardiologist from Hyderabad. He will shed light on the crucial topic of identifying typical and atypical symptoms of heart attack and what to do about it. In this session, Dr. Sarat will offer his valuable insights into recognizing the early warning signs and taking timely actions to potentially save life. Dr. K. Sarat Chandra is a distinguished senior consultant interventional cardiologist currently practicing at Jayanti Super Specialty Hospital in Hyderabad. He is renowned for his pioneer contribution to interventional cardiology. Dr. K. Chandra brings over 34 years of unmatched expertise in advanced and minimal invasive cardiac procedure. Also, Dr. K. Chandra was the editor of Indian Heart Journal year 2012 to 2014. Also, as the president of Cardiological Society of India in 2018. With this brief introduction of Doctor, let's start with the conversation, sir. Yes. So my first question to you would be like, what are some common or the typical symptoms of heart attack?
Well, heart attack, let me just take a moment to clarify this word. Heart attack means suddenly one of the blood vessels which supply blood to the heart, it gets suddenly occluded, means completely blocked. So that is what produces a heart attack. If it happens suddenly, if it closes over course of time slowly, then it may not produce a heart attack. Most likely it won't. On the other hand, a very similar symptom is what we call unstable angina, where patient gets recurrently chest pain without producing a complete heart attack. And then little short of that is somebody who gets chest pain on walking or breathlessness and walking, and that progresses over course of time into other events. So the last one is called exertional angina. So we need to have a little distinction. We need to understand the distinction between a proper heart attack to what we call an unstable angina to exertional angina. So now coming back to the symptoms of a heart attack. Out of these three, most important thing is to identify by the patient himself that something is going wrong in the setting of a heart attack itself, proper heart attack. So this is what we call acute myocardial infarction, and it is extremely crucial, to say the least, that the patient identifies it, tells his family members or friends, whoever is around, and urges them to take him to the hospital or himself goes to the hospital. And so what are the complaints that he or she may get when a heart attack occurs? That is a very crucial question, because if you do not know how to identify, then you are likely to ignore it. Now, most important
Yes.
complaint is chest pain. This chest pain usually in a heart attack occurs in the central portion of the chest. It can occur to left side of the chest alone, or rarely to the right side of the chest. And sometimes this pain, from being in part of chest, it may go to abdomen, to the what we call abdomen, the stomach, what the lay people call. And then the pain may go into his left arm and rarely to the right arm. The pain can sometimes go to the neck on both sides. It can even go to the jaws. So it can have a varied presentation. When pain occurs, this is how it occurs. Now, unfortunately, most of our patients are reluctant to accept the word pain. They often say that, no, it is not pain. It's something very strange happening, some heaviness, or that's a very commonly used word by the patient. But when you talk to him more, he accepts that there is a pain actually. And of course, it can occur without pain. It can be just breathlessness. He feels breathless while sitting. He was okay till morning. and he had his breakfast, and then around 11 o'clock or so he started feeling some kind of breathlessness. He's not able to walk a few feet also. While sitting there, he's feeling breathless, and then that can actually ask the patient to tell the patient to he has to convince himself that something is going wrong and then rush to the hospital. Of course, more often these symptoms occur early in the morning. 11 o'clock in the morning is an unusual time. More often, this occurs early in the morning or middle of night. But then, there is nothing like, it cannot occur at a particular point of time. And it takes time for the patient often to recognize. Many a patient initially attributes it to, it's a gas, because gaseousness also produces complaints in the middle of the chest. So, but then that pain due to gaseousness will almost never go to the arms. It may just stay there in the center, and after some belching, it may go away if he's lucky and not having a heart attack. But more often than not, most of the educated patients also, including doctors, I've seen more than one doctor who said, no, I don't have a heart attack. It is just gaseousness. Actually, he was having a heart attack. So this kind of a hopeful denial of symptoms is a big problem in our society. He just wants to say that, no, I don't have anything. Only the electrocardiogram, when it is done and somebody tells him, look, you are having a heart attack, only then he will convince himself. Yeah.
Yeah, after getting some proof, they will be
Yeah.
convinced. Like, okay, thank you, sir. So my next question to you is like, how the heart attack symptoms may differ in men and women.
Okay, this is a important question. Uh, Women, for some reason or other, are far more reluctant to go to the hospital than men. The reluctance starts from the family members itself. They will simply say, no, this girl always says like this, or this lady always complains something or other. And it is true that sometimes women have generalized symptoms, and for all these social reasons, many women, they come rather late after the onset of heart attacks. Men also come late, but women come even later. Okay, now women are even more reluctant to accept that they are having a chest pain compared to men. That is the more unfortunate thing. And since we know this disease occurs less commonly in women compared to men, there is a reluctance on the part of everybody, including the patient herself, the husband, the family members, and even the doctors. They say, no, these it is very unlikely. She is very unlikely patient. It is only by doing the electrocardiogram, the ECG, or further investigations, observation, etc., that you can really exclude it. We see today any number of women, young ladies, who are not smokers. That's another big problem in our society today. That earlier, when let us say when I was doing MBBS, we never saw any women smoking. It is just unthinkable. Today, it is no longer the case. You see any number of young ladies, particularly in a where there is a high income group of people, smoking has become very prevalent, and so you can never exclude on the basis of the patient being a woman or belonging to the favored sex that it is unlikely to be heart attack. And always never hesitate to ask the lady, do you smoke? You need to ask specifically that question. Only then she may tell. I will tell you an example which happened very recently in our hospital. That one young lady, she's just 25, she's working for a software company. She came with a proper heart attack. She came late, all right. And, when I asked her more than once, she said, no, I don't smoke. Only on the day of her discharge, after everything is over and she's going home, she accepted finally that she was smoking fairly frequently. So, there's a reluctance on the part of the patient also to accept the truth. If you're smoking, you are doing that. Give the information to the doctor. So, it's like giving information like you have got diabetes. It's as simple as that. So, in women, coming back to your very pertinent question, women either they have less often chest pain, or they probably deny that. But the fact is that more often than not, they complain of breathing trouble. They say, I'm feeling breathless. And sometimes they will just say, I'm just feeling weak. I've seen at least a few patients who just came with low blood pressure and weakness. She just said, I don't have any kind of chest symptoms. All she is saying is, I'm feeling weak and the blood pressure is low and the ECG showed heart attack. So these kind of very unusual presentations are more often seen in women.
Okay, thank you, sir. Sir, can heart attack occurs without chest pain? And if it is so, like how can we recognize it?
Well, as I was telling you, heart attack can jolly well occur without
Hmm.
chest pain. It can just present as difficulty in breathing or weakness and vague symptoms like that. The This situation is more often seen among diabetic patients. For some reason, diabetic patients have got neuropathy, which makes them may not have pain at all. All that he has is kind of feeling weak or breathing trouble, breathless at rest. It can also occur in very old people, those who are in the 80s, 90s, and sometimes you see such patients nowadays more often because Indians as a whole are living longer. So you do see patients who are very old. Among them also, chest pain may not be there. All that he has is breathing trouble and weakness kind of symptom.
Okay. Sir,
Finally,
can you tell?
identifying is by doing an electrocardiogram. ECG, without ECG, you cannot make a diagnosis. Of course, troponins are a blood test which is done. We need not go into the intricacies of a troponin test, but many patients and in the society, general public also know there is what is called a blood test. But this will not help in those cases which are straightforward heart attack. If somebody has got ECG changes, then you don't need the troponin. It is only in those patients in whom the ECG is not showing changes or vague changes, not clearly suggesting heart attack, that these tests help. But these troponin test is useful if it is positive. If it is negative, it doesn't mean it can really rule out a heart attack.
Okay, okay. These two tests can be done for the
Yes,
proof, for the proof like we are
of
having
course,
heart attack.
examination by a doctor, history taking by a doctor are of utmost importance. And then, of course,
Yes.
echocardiogram is another test.
Hmm.
What people call echo. Echocardiogram is another test that will throw light on, certain abnormalities can be seen in the echo that can make the doctor make a diagnosis.
Thank you, doctor. Doctor, can young people or those who are physically fit can still suffer from the heart attack?
Oh, yes. We are,
Like physical.
as I told you, we are seized of the problem. We see any number of people who are young, who are otherwise fit, he can get a heart attack. He or she, let me say. Okay.
Yes.
Now, question comes, he may be fit, but he may be still doing wrong things like smoking, wrong things
Yeah.
like not doing adequate exercise, eating all junk food, and eating roadside food where there are trans fatty acids. These fellows who sell, various things on the roadside, like your Bombay or Hyderabad or any city, you know, they keep on using the same oil, and the fatty acids change their configuration and they can become trans fatty acids, which are extremely harmful. The trans fatty acids have been banned in all over the world, and the WHO and in fact FFSG, called in India, government body which determines which foods are healthy and which foods are not. They all said that we should aim for the lowest possible trans fatty acid content in our food. Many people do not recognize it, but these roadside foods are extremely harmful, and all these factors have to be considered. He may be looking physically fit, but he may be actually having diabetes, which has been going on for some time but has not been recognized. You know, Let me just say one sentence, little going out of your discussion, that diabetes and heart attack, different faces of the same monster sitting inside. The monster's name is insulin resistance. Resistance to insulin, sometimes it presents first as a heart attack, sometimes it presents first as a diabetes. So, whenever you see a heart attack patient, you tell him, look, today you are not having diabetes, but you can jolly well develop diabetes over course of time. Many of our patients come to us for years, and we see them developing slowly diabetes, and diabetic patients getting this disease. It may not always be heart attack, it may be coronary artery disease or atherosclerotic vascular disease, as we call. So, You can be physically fit, but you can still develop heart attack if you smoke, if you have diabetes, if you are eating on the roadside, if you eat all wrong food, you don't eat adequate amount of fruits in your diet. They all can produce it.
Okay. So, linking to this question, and we have most common question from the audience is like, are there any particular lifestyle habits or the symptoms that one should regularly monitor to prevent from heart attack or to avoid the heart attack?
Absolutely. Most important thing I would say, everyone should understand that some degree of exercise is very important for all of us. I would say if you walk every day 45 minutes to 1 hour, as much as possible, walking or doing exercise, uh, if it goes off smoothly, you don't get any breathing trouble or chest pain, you are unlikely to be having serious blocks in your heart. That can be generally said. You may be having mild blocks, but they are unlikely to be having serious blocks. So I would say everybody in the society, young and old, men or women, everybody should do a minimum amount of walking, at least 150 minutes a week. That will do two things. One is it will improve your so many aspects of health. What are those aspects of health that will be improved by exercise? Your blood sugars can come down. Okay, your HDL component in the blood will go up. The blood pressure will come down. It will keep your weight in check. If you are likely to get your diabetes because your mom and dad have diabetes, at least this exercise will postpone you getting diabetes for few years. And if you can postpone, say, diabetes onset by 10 years, you should be very, very happy. So exercise will do these benefits to the body. I can go on telling you many benefits of exercise. In addition to that, the exercise will give you an early warning. Suppose you have been walking on Hussein Sagar or Marine Drive or any place in this country, and you are walking for 45 minutes every day. You don't have any complaints, but today you are developing some breathing trouble. Watch out! It is a trouble, and you should go to a doctor. So exercise will prevent many problems from coming. Two, if the problem is likely to come, it will give you a very good notice. So that's the probably the second one is actually more important thing, and you can go to the doctor, you can get your workup done, and prevent yourself from suffering from serious damage from future heart attack.
Yes. Thank you so much, sir, for this information. My last question to you is like, what are the known causes? As we have talked about the symptoms, now what are the most known causes of the heart attack?
uh, you know, no discussion on anything in relation to heart attack will be complete without talking for a few minutes about the causes of heart attack. Now, the causes of heart attack are called risk factors. Old days, 1940s, around World War II time, in the United States, there's a place called, Framingham. Framingham is a village near, I think, Boston, and they recruited the everybody in that village and followed them up over course of time, and hundreds of scientific articles have been published on follow-up of this Framingham cohort. And it is from the Framingham that this knowledge came, that there are certain what are called risk factors which make he or she prone for future heart attack. Now, what are those risk factors? Now, what we are talking now is not just in relation to Framingham data. There is so much data that has accumulated over course of decades from that time. But let us first uh, talk about those risk factors which are most important. Okay, there are many risk factors. All of them are not relevant to this discussion. Most important today, I would stress, and preventable, eminently preventable, is smoking. You know, Unfortunately, although the smoking levels have come down the world over, there are still countries like India where younger and younger people continue to fall prey to heart attack. In our hospital, or for that matter, in Hyderabad, where I've been living for a long time, if 10 people come with heart attack in young age, I'm talking about less than 40s, most of them will be actually smokers. And if a young lady comes, as I told you earlier example, that she's
Yes.
likely to be a very likely to be a smoker. Unfortunately, in India, despite maximum effort by government, by various private bodies, hospitals, doctors, everybody talking about health like this Facebook Live, people continue to smoke and suffer from heart attack. So, if there is one risk factor which we should talk about, which we should prevent, we should drive out of the society, is smoking. The smoking can be cigarettes, the smoking can be chutta, what you call, in you go to village like place, you will see they'll simply fold the tobacco leaf and then just smoke it. Okay, maybe BDs, any form of smoke. As such, in a progressive society, progressive means within brackets, more and more automobiles, pollution in the society. You and I cannot take away the pollution of the air. Okay, that's a
Yes.
much bigger question. But at least personal smoking is most dangerous. And second-hand smoking, what we call passive smoking, husband smoking in the house, affecting the wife. She also is more prone for heart attack, and not only the person who smokes. So we can talk endlessly about smoking and its ill effects. I would say, if the audience, if one person who is listening to this stops smoking, I would be I would say we have achieved something great. After smoking, we should say it is the age that makes actually one prone for it. The older people are more likely to get it as they grow old. It is an inevitable thing that happens in the body, that the fat accumulates in the body's blood vessels. In some, it comes very late, and in some, it comes early. And age is an important thing. Men are more prone for heart attack than women, but that statement is only correct if she is not smoking, if she is not a diabetic, she is not having high blood pressure, she is not prone for extreme stress for whatever reason. Okay, so in general, men are little more prone for heart attack than women. Okay, diabetes is another big risk factor for heart attack. Somebody
Yes.
with diabetes walks in and says he's having something. We would, the first question that the doctor asks, "Are you having diabetes?" The moment he says yes, always your tentacle should go up, and you should suspect that probably he's having a heart trouble, because heart disease and diabetes are, they love each other. Putting it simply, they just love each other. Diabetes hits the vascular tree in the body. It produces a stroke, that means a paralysis like symptom early in life. It can produce heart attack, it can produce blocks in the blood vessels supplying blood to the legs, and endless effects of diabetes. And another thing is high blood pressure. High blood pressure is very often ignored. It is generally believed that only one third of people who are having a blood pressure have their blood pressure controlled with adequate amounts of drugs. Another one third, they know that they have got high blood pressure, but they don't take good care of their blood pressure control, and they just take some tablets or no tablets and so on. And the remaining one third, actually, they never know that they have got high blood pressure. Yesterday,
Yes.
one fellow came to me. He is only 35. He says, I don't have any high blood pressure. He was having some chest pain. Somehow came and got admitted under my care. He says, I don't have blood pressure. His ECG shows severe left ventricular hypertrophy. His echocardiogram shows severe left ventricular hypertrophy. His blood pressure was 200 by 140, but he never knew that he has been having high blood pressure because he never checked it. Simple as this. How will you diagnose diabetes? Only if you check blood pressure. Sorry, blood sugar. How will you diagnose high blood pressure? Only if you check it. You can diagnose a heart attack only if you take an ECG. So, preventive checkups from time to time, right from school age, are very, very important. Right from before passing the 10th class, we should check the blood pressure and blood sugar and weight of the child, and then guide him or her properly. That will go a long way in preventing. So, smoking, high blood pressure, diabetes, these three are the most important, easily recognized, well accepted risk factors. The other risk factors are many, but one of the most important, I would say, is having lack of exercise. Somebody looks, average body weight, and may not look obese, etc., but he doesn't have any exercise. He sits in a shop and he writes accounts. He just goes in the morning, till night. He just sits there. And another, I'll tell you a very famous patient of mine. Three brothers. They are gold workers. They just sit in a gold shop and they go on doing that gold work of making whatever jewelry or whatever. The fellow just sits there. He has no physical work as such, and therefore, all three of them had blocks in the heart. One came in the heart attack, and then the other said, let me also check. And then when I found that all three of them are working in the same gold shop, I said these fellows also may be having. So poor exercise is another very, very important risk factor for heart problem. Okay, and then there are some things like eating fruits. If
Yes.
somebody eats a lot of fruits, it decreases the chances of having a heart attack. So those countries like Mediterranean countries where they eat a lot of green leafy vegetables and fruits and so on, they have lesser incidence of heart attack, even though they are having other risk factors. So food has something great impact on what you eat. Also makes a big difference for the patient's body. And another important risk factor is extreme stress. You might have read in the newspapers somebody committed suicide in Pune or Bombay because there is extreme pressure from work. That can mm, also lead to heart attack. So extreme stress, whether financial stress or some other stress, can lead to heart attack.
Yes, sir. Truly said. Like there are so many things that they are in our hand to control, from eating fruits to doing the daily exercise to the regular checkup to avoid smoking. These are the many such things that we can avoid and prevent ourselves from heart attack. So thank you,
So
sir.
are there any questions we can take, madam?
Oh no, sir. That's all from my end, sir.
I know. I know. If you have a couple of minutes, then we can see what are the questions. Somebody, can you open that question box? I think there is. No, I don't see any questions here. All right, then. Thank you very
Yes.
much.
So
Thanks for giving this opportunity to Heart Mitra and AstraZeneca. Thank you. Good day to you. Can I leave now?